Hello, everyone. Einstein's Eyes. I'm Carl Rosen, oculoplastics, neuro-ophthalmology, primarily oculoplastics now in Anchorage, Alaska, for the past 30 years. My friend and partner, Jon Ditkoff, is in New Jersey. We were residents at Albert Einstein. Jon?
Hello, everyone. My name is Jon Ditkoff. I'm a general ophthalmologist, specialize in cornea. As Carl said, I'm in northern New Jersey, just about 20 minutes out of the city. We both trained in New York. He's kind of at the other side of the world, but I'm very excited about tonight's topic. Very different for us, but we've been alluding to it through our channel. I mean, AI is part of a lot of things now, so I'm really excited to hear more about it.
Right. So thanks, Jon. So artificial intelligence, how it will impact healthcare. We have a very special guest, Robert Pearl, MD, who has written a book recently, GPT MD, How AI Empowered Patients and Doctors Can Take Back Control of American Medicine. It was published recently, April of 2024. You can get it on Amazon. It's doing really well, as it should. The bio for Dr. Pearl, former CEO of Permanente, the Permanente Medical Group, Kaiser Permanente. Also the former president of the Mid-Atlantic Permanente Medical Group, clinical professor of plastic surgery at Stanford University School of Medicine, and on the faculty at the Stanford Graduate School of Business, better known as the GSB. I spent some time there. He teaches healthcare strategy, technology, and leadership. Dr. Pearl is board certified in plastic reconstructive surgery. He received his MD from Yale, followed by a residency in plastic and reconstructive surgery at Stanford. Very qualified. 3 books, as I mentioned. The other 2 are Mistreated, Why We Think We're Getting Good Healthcare and Why We're Usually Wrong in 2017, and Uncaring, How the Culture of Medicine Kills Doctors and Patients in 2021. Fantastic. Dr. Pearl, welcome again to Einstein's Eyes. We are eager to hear your comments and thoughts. Please kick it off for us.
My pleasure. Book, as you noted, is doing well. #1 on Amazon's best new books, and all profits go to Doctors Without Borders, which is a great charity for anyone who's not had the chance to know about it or to contribute to it. Let me start with what you said about my previous 2 books as the place to have as the launching pad for a conversation about generative AI. The first book, Mistreated, was written in 2015. And I wrote the book because I could see the problems in the system of medicine. It was a 19th century cottage industry. It was fragmented, paid on a piecemeal basis. We called it fee-for-service. Technology was left over from the last century, although really from the one before, since the most common way doctors exchange vital medical information through the fax machine, an 1834 invention. And there was no real leadership structure to make change happen. And probably I was a little bit naive at the time. And I thought that if I could highlight all the challenges that were there and point to a direction that could improve them, that people would embrace it and go forward, which was my goal, to transform American healthcare. Having been the CEO of Kaiser Permanente, that was the next thing I wanted to do, is address the challenges across the entire United States. I wrote the book, and a lot of people read it. It was a Washington Post bestseller, but little change or no change at all happened, particularly in the movement towards what's called value-based care. I thought about that. I always ask why. That's maybe the business school professor in me. And I said, the reason is probably people can see that the culture is broken, but that the system is broken, but the culture stands in the way. And culture is the values, the norms, the behaviors that we learn in residency and medical school and carry with us our entire life. So I wrote the second book, Uncaring. It was a Kierkegaard Award winner. And again, nothing changed. I asked why. I said, what could possibly be standing in the way? The arguments are so powerful. And they're not my arguments. They've been around since 1932, when the Committee for the Control of Medical Costs had the same conclusions almost 100 years ago. And I came to the conclusion that the problem was that we didn't have a tool that would allow us to make these changes. And by value-based care, what I really mean is that the way we address affordability, the way we lower the cost of medicine, make it affordable for people, is not by skipping and cutting back, but by through higher quality and greater and more convenient access. So that was the origin of this book. basically started about 2020 when OpenAI released ChatGPT, which was the start. As you say, my co-author is ChatGPT. We can talk about that a little bit later and how that came to be. But basically, I looked at this question and I said, okay, now that we have the tool, what does it mean? What can it do? What are the problems that exist? So when I went back to look at American medicine, I said, wait a second, we have 400,000 people who die annually from misdiagnoses. We have 400,000 more who have permanent disability from misdiagnoses. 250,000 die, including my dad, I wrote about it in Mistreated, die from preventable medical error. And we know that at least 500,000 people die from poorly managed chronic disease. We're talking about hypertension, the number one cause of strokes. We're talking about diabetes, number one cause of kidney failure, major contributor to heart disease, and as you well know, a major contributor to blindness with the retinal disease that comes from this problem, as well as accounting for maybe 80 or 90% of peripheral amputations. According to the CDC, if we could better manage these, and right now we manage hypertension 55, 60% of the time, we manage diabetes less than a third of the time. If we could manage them well, the CDC says 30 to 40% of heart attacks, strokes, cancer, kidney failure, peripheral amputations would go away. Now I say, wait a second, that sounds pretty amazing to me. Imagine the quality, the extended longevity that would happen. Imagine what happened to cost. 30% of heart attacks and strokes and cancer and kidney failure, amputations didn't exist anymore, weren't required. How much longer would people live? And maybe more importantly, how much healthier would they live in the last years of their life? Tremendous opportunities. But I said to myself, this technology is advancing so fast. It's doubling every year. That means in 5 years, it's going to be 32 times more powerful. That's like your car going as fast as an airplane 5 years from now. 10 years, 1,000 times more powerful. And so far, since I wrote the book, the trajectory has actually been more rapid, not less rapid than thought at the time. But I said I have to do it more quickly, which is why I brought ChatGPT online. Plus, I wanted to see how it would do. And I want to stress that I'm not talking about AI. I'm talking about generative AI. And generative AI is very different than other types of AI. There's rule-based AI. That's when a clinician puts into an AI system a set of what's called heuristics, shortcuts. It's the way that doctors learn. If a particular pathology slide shows a lot of cells dividing and really weird-looking nuclei, and it's invading tissue, we call that cancer. Well, what happens with a rule-based AI is that we give it the same rules, but it's never as good as the human because we can't capture in words all the things we intuitively know. That led to next, which is narrow AI. This is where we take 10,000 mammograms, or maybe let's just talk about your specialty, 10,000 retinal exams. 5,000 of them show diabetic retinopathy and 5,000 of them are normal. And the application is now asked to compare the two, and it comes up with maybe 30 differences. You as a ophthalmologist might only have 5 or 7 that you look at, but it can look at all 30 or 40 or 50, coming up with probability factors for each. And that's an area where ophthalmologists do very well. So probably you do well and it would do well. But other areas of medicine like mammography, it's actually about 10% better than clinicians. The challenge with narrow AI is it's narrow. You can only apply mammography to mammograms. You can't do it to chest x-rays or to brain scans. You can only do retinal scans to retinal scans. You can't do it scans of other organs or other areas of the body or the skin for that matter. And that leads to generative AI. Generative AI is completely different. We should stop using the word AI alone. Generative AI is a particular type. What happens, think of the letters GPT, it's PTG. It's pre-trained. Everything on the internet has been uploaded into it. We're talking about every medical textbook. We're talking about every journal article ever published, having been pre-trained on all that information. That is transformed. It's what's called parameters. We say articles from journals that are more recent are more valuable than past ones. Articles that are peer-reviewed are better than non-peer-reviewed. Articles that come from major academic centers, like the ones you trained at, are better than ones that just come up from a source that we don't really can identify. And out of that, it can generate an answer to any question. It is generative. It's able to answer any question, whether it's around the eye, whether it's around the heart, whether it's around the GI tract. It doesn't matter. It has that ability to do so. But it has another characteristic that I really want to stress, which is that if you look across history, what you see is there's been an evolution with multiple breakpoints where we have, I'll call it democratized knowledge. Printing press is a great example. You have Johannes Gutenberg has the printing press. Books that had been the sole purview of the royal families now became available to the middle class. You had universities springing up. You had libraries being created. You leap forward, you look at the internet. Now from our homes, we can access a lot of information. Google search allows us to be able to find information when we need it and want it. Then you have the iPhone. We carry that knowledge now in our pocket. But I want to stress, it's just knowledge. What generative AI does is it provides expertise. So let's look at some of the applications, if that's okay, so that we can understand the difference between expertise and knowledge. If you look at American healthcare today, with all of its problems, I spoke about some of the deaths that could be prevented. We know that care is unaffordable for over half of Americans. We know 60% of clinicians are burned out. And that was on your show last time with Jonathan Fisher, an excellent program. If you look at all those components to it, what you see, I think, is the crisis in chronic disease. It's snuck up on us because it's happened over decades. You see a patient with an acute problem, maybe let's say appendicitis, and you have to do intense treatment for a week with a follow-up maybe a couple of weeks or a couple of months later. If you come in with diabetes, I'm going to see you 3 to 4 times a year for the rest of your life. And we have not recognized how much more work that means. It's why doctors run on a treadmill ever faster. It's why we go home at the end of the day feeling like we could have done better if we had more time. It's time that's the problem. It's not a lack of expertise, dedication, commitment, or anything else. We just don't have the time. And this is an opportunity that exists. So let's look at expertise versus knowledge. For at least a decade, my colleagues at Stanford have been developing these amazing wearable devices. I don't know how many of them you've seen. They're incredibly accurate. Blood pressure, pulse, blood oxygen, blood glucose, blood pressure. The tools are remarkable, cardiac rhythms. We can tell a lot about patients. This is a technology, I'd say it's 99+% accurate. And how much do we use it? Close to zero. Again, I always ask why. What is it about this technology that we don't use it? And the answer is this incredibly accurate data can't be applied by the patient. You do 100 blood pressure readings, 80 are normal, 13 are abnormal, 7 are borderline. Does that mean you're doing great because 80 are normal? You're doing terribly because 13 are abnormal? You don't know what to do. And the last thing the clinician wants is for you either to bring in a list of 100 blood pressure readings or send it to the individual's electronic health record and clog it up. So we have a tremendous application. We just can't use it. And why is this so important? Because that's the way that we manage, along with laboratory results, chronic diseases. And so the opportunity that sits before us is to say, how can we better manage chronic disease? You go to Google and you click on hypertension, you're going to get a lot of information, but you're not going to get anything to do with that information. You put all that data inside a generative AI application. And I want to stress for listeners and viewers, not what exists today, but what's coming in 3 to 5 years. Put that all information in a generative AI tool, and you know exactly how you're doing, particularly if the doctor has pre-programmed through what's called the GPT, a plugin, expectations. I see you in January, my blood pressure is elevated, you start a medication. 4 months later, I see you, you have no idea what's going on. No. Within 1 month, because that's what the time frame that you laid out in your GPT, my blood pressure is still elevated. You can know about it and change the medication with a telemedicine visit, not with a lot of in-office care. 4 months later, my blood pressure is under control. I don't need to see you for at least another 4 months. That's the opportunity that exists. That's opportunity to better manage chronic disease and avoid its complications. Take some other examples. What are patients going to do when problems arise? Sure, we can say, just call the doctor. Most doctors are pretty busy. You want to take time away from work? You want to fill up the doctor's schedule? We want to develop expertise. What does that look like? Okay, let's assume it's 11 o'clock at night. Your child has 102.5 fever. Do you go to the ER where you'll wait an hour? Do you go to the ER where you'll be surrounded by patients with coughing and infectious disease? Or do you wait until morning, knowing, because you clicked it on Google, it could be meningitis, your child will be dead. You don't know what to do. You call the office, and you get a recorded message, go to the ER. Why is that? Because that protects the doctor. You go to the answering service, what do you get? The doctor will call you back in the morning. No, you need expertise and information at that time. Is it going to be perfect? I doubt it, because nothing is perfect in medicine. Nurses can't give perfect answers because we don't have complete information. Even doctors can't. But is it far better than what exists today? Absolutely. I'll give you one last example, which is I did a podcast a couple of weeks ago around the book. At the end of the program, the interviewer said, Dr. Pearl, you're a skier, you're a doctor. Let me just ask you. My husband fell skiing 2 months ago. His arm was over his head. He slid down about 100 feet. His shoulder still really hurts him, and he can't do things with it that he could do with the opposite arm. What's wrong? And I said, I have a pretty good idea of what's going on. I am a skier, and I am a doctor, and I think I know what's happening. But why don't you put it into ChatGPT? She had never used it before. About 5 days later, she calls me back and says, thank you so much. So I put all the information, everything I could think of, into the entry point, and it said, the most likely diagnosis is a torn rotator cuff. He needs an MRI and probably needs surgery. You should contact an orthopedic surgeon soon. This was not general advice, go see an orthopedic surgeon. This was very specific, expert information. She called the doctor up, surgery went well, and the doctor said to her, had you waited a few more months, I might not have been able to reattach that tendon that was torn off of the bone because the muscle would have contracted. That is the difference. This is what's called the Khan Academy in Silicon Valley. It turns on its head the way that education is done. You know, when we went to school, you go to class, you study a subject, you go home that night, you do the homework. Now in the Khan Academy, you go online the night before the class. You learn a lot about the particular subject at your own pace using a computer application. And then in class, you can delve that much deeper. Imagine if the patients coming to your office were already expert on the ophthalmologic problems they most likely had. How much easier would it be for you to have that conversation? How much farther along could you advance it? That's the opportunities that exist now. And I will add one more piece, which was the announcement last week by OpenAI, that they had a next generation. They call it GPT 4.0. And what it does is it now is multimodal. So you not only have what exists right now, which is typing, but you have voice and images and videos. And now you have the opportunity to really see it as an assistant, as expertise in your home, wherever you go, expertise to help the doctor, not just the patient. I tell in the book the story of a physician that I know who did a very complex neck surgery. At the end of the operation, the anesthesiologist said that the cords were what's called adducted, almost touching each other, and that if you remove the breathing tube, the patient would probably have obstruction of the airway and would either need reintubation or tracheostomy, and recommended transfer to the ICU. But she knew she hadn't damaged anything. So she looked in the literature, asked GPT-4, and she found multiple case studies with the same thing. Because in some patients, that anesthetic diffuses more rapidly and further. And in this particular case, affected the intrinsic muscles of the larynx. And in every case, the patient got completely better. A half hour later, once the anesthetic had worn off, and that's what she did. She stayed in the OR, patient intubated. 30 minutes later, the cords came apart. Anesthesia extubated the patient, and home he went. That is expertise. And with medical advances happening, doubling in medical knowledge every 72 days, all of us as clinicians will benefit from that rapid and easy access to the most up-to-date recommendations. Let me stop at that point and see if you have any questions or any thoughts that listeners might have about generative AI and ChatGPT MD, the book in particular. And if they want more information, by the way, they go to my website, robertpearlmd.com.
That's great. John, anything?
Yeah, I mean, that's mind blowing. So I'm thinking out loud. Part of this, I feel like I thought about a patient that comes into my office and says, I read all about floaters. I know I have to come in, and they really nail it. They come in like kind of what you were saying, just from going on Google. But then there's other people that I guess are reading different information or fear things, or they go into chat rooms and they read about it. Not being that computer literate, like how does this screen out information that's in the internet that's from someone that just put in, oh, I had floaters and it ended up being a brain tumor, which is not the case. How does this do this for them?
Sure. Well, it doesn't completely screen it out, just like they could call a neighbor who could give them bad advice. So I don't want to tell you that it completely eliminates it. But why is it so much better? Because it has the totality of the literature. So if there's one or two misinformation telling you to take bleach when you have COVID, it'll be offset by the 100 other pieces, and it will put the CDC recommendation over that of non-clinicians. So that's an example of why it is likely to be better. But I'm going to tell you a really embarrassing story about myself, if that's okay. Sure. Which is that I was doing some rock. Well, you made me think about it. I was doing some rock climbing, and I took a hard fall, hit my face. And following that, I had these really cute things running across my visual field, the floaters that you're describing.
Right.
And I observed it for a full day before I did anything about it because I thought it was cute and it would go away.
Yeah.
Had I put that information, had I had access, this was now several years ago, but had I had access to ChatGPT, I would have put the information in there, and I can guarantee you the first thing it would say is you probably have a retinal tear, go see an ophthalmologist today, immediately.
Well,
so that's an example of an opportunity that I missed that I would have had currently.
Yeah. I mean, I think I have patients that will do those kind of searches. And I guess right now they're using either a better search engine or they know how to use a computer better. It sounds like ChatGPT will make it easier and simpler for people. Is that the idea?
Yeah.
I mean, that's one of the benefits, obviously.
Yeah. Also, how you ask the question. So the prompt in the field that's afforded to you, or that ChatGPT, the entry point, as you said, where you access the system, you access the information, and then GPT will provide a response. Usually it's a short response, which is real nice, but it depends on how you ask the question and the data, the information you give it. So the prompt, which is that question you're asking, is really important, and people will get better at it. And ChatGPT will also get more friendly. The user interface will get friendly and make it easier and easier. But you're right. When you went from 3.5 to 4 to 4.0, it just gets improved, better and better, easier, and you can put more types of data. You can put the images, you can put a contract, you can put lab data, and then it will create an Excel chart or some kind of spreadsheet or some kind of table so that it's easily viewable and it makes sense. And the nice thing is that you can ask it, say, look, make sense of this for me. So that's the great part about this. And, if I could expand on this, and I appreciate your explanation of your inspiration and your goals, and how AI in healthcare will interface and how it'll be impacted. But, I'm thinking about it from a personal insight, how it affects my office workflow. So it doesn't right now, but if we could get an API or some kind of interface program between ChatGPT and my medical record, so that it could dive into that patient data from 20, 30 years ago, because my office has been around for a long time, it would know more about the history or historical information than I would, because I just can't remember everything. It collates that information and provides a really, really strong treatment plan and assessment. Could print it out for the patient so they have it to go home with, which we don't normally do. Send letters out to the referring doc or to any interested doc, the primary care or what have you. And if I see a way to go from speech to text, all of a sudden now I save a bunch of money by not having a scribe. And that's what I'm looking forward to. And my guess is that you probably have some insight into that as far as the future of AI in medicine and the advice for healthcare professionals. Further, and the impact on patients. Any thoughts on that, Dr. Pearl?
Well, what you're describing is happening right now. I mean, the virtual scribe that has been talked about now for over a decade is becoming a reality with generative AI, and it's doing well and doing better. So that's the first thing that I would say. The second, I want to go back to the start of your question and comment, is that what we need to be doing is training both our clinicians and our patients about how to use this tool. Exactly, you say, it's estimated to take about 10 hours of experience before you get really good at it. And no clinician has the time to train every patient. But why not have the societies, or why not have our facilities train, create videos or create manuals for how to do it, for the kinds of questions to ask. And that's what I think we should be doing now. So the administrative tasks, I think, are going to happen very fast, but it's really the patient ones. And I don't know about you. I'm a surgeon like the two of you. I fix kids with cleft lip and cleft palate. We all give complex information to families when they leave, particularly after a procedure. And if we gave them a test on it, I doubt that any of them would score 50%. That's just the reality. First, it's overwhelming. The language is there. How do I put these drops? How do you put drops into an eye without getting the kid to blink? How many times a day is it? If I spill a drop on the ground, do I forget about it? Do I put it back in? The number of questions are non-ending that families appropriately have. We expect that they're going to have a tremendous amount of skill. This tool can support them once it's been shown to be totally reliable. Right now, as I said, it's not ready for prime time, mainly because of what's called hallucinations. But those will be taken care of. We can expect as the power increases 32-fold over the next 5 years. Imagine how many patients delay a couple of days. I gave the example myself and my retinal tear, but how many patients aren't sure what's happening? What do I do with pink eye? Do I come in? Do I not come in? What should happen? Well, it's a pretty straightforward approach. We don't necessarily know every answer about it, but the things we know how to communicate effectively around. You tell the same thing to every family that comes into your office. I guarantee it when it comes to pink eye in a young child. Then how do we take care of that? Find ways to do it so that instead of having to spend that time in the office saying the same thing you said before many times, now you can focus on the patient for whom that extra little bit of time is going to be important. People worry it's going to diminish the doctor-patient relationship. I think it's going to augment it. It's going to make it more continuous. It's going to make it feel more personal once we have the tools in place to allow patients, as I say, I like that phrase, to be empowered. It's the triad. It's the dedicated doctor, dedicated clinician, the empowered patient, and the generative AI. And I'm absolutely certain that very soon, the combination of all three will be better in terms of quality, in terms of satisfaction, in terms of affordability than any one alone.
I think that's great. I love what you said about just having a really smart assistant that is there looking over your shoulder to help you out when you need it, or just incorporate it into your daily workflow, into the practice of medicine. I love that. For you, for the doctor, for the patient, for your staff, for the administration, just a powerful assistant. So really, really great
I get the
job.
impression that it's really going to help the patients, which will help the physician. I mean, basically, it's like educating like I'll give you a perfect example of floaters. In my office for 30 years, when a person comes in the office and tells my staff they have these new floaters that started 2 days ago, my staff knows exactly what to do. They need to dilate the eye, put them in a special room. They give them a brochure. They don't just hand them the brochure. It's a floater and flashes brochure. And they say to the patient, read this before you see the doctor. Why are they doing that? Makes my job easier. It's exactly what you're saying. We've been doing it for 30 years, but this is so much better because now the person's coming in, they're their own advocate. I think, in my setting, sure, by the time I walk in the room, I would say 80% of my patients actually kind of understand it. So it makes my job easier to explain it. They look at pictures. But I think it sounds great. It's exciting. I think my main reservation, I still think, but I like the way you said it, which is just like your neighbor, you're never going to get great advice. You have to always take that, and it's going to get better. I think at the beginning, it probably will be overwhelming, and then it'll get better and better very quickly, it sounds like.
Yeah. So, so Dr. Pearl, Jon, let's have some closing thoughts. Jon, any closing thoughts?
I mean, I'm very excited. This is something that I really don't know much about, other than, just like everyone else, I've tried ChatGPT. I check it out. It's very exciting. I'm looking forward to reading your book because I want to learn more. And you gotta change with the times.
Yeah. I also see, Dr. Pearl, maybe you could give a few thoughts on this, that we're going to be using virtual reality, augmented reality, in addition to this, so that not only can we put images, text, lab data, numerical data about the patient, but we'll be able to give a patient a visual perspective of what's going on with augmented reality or virtual reality as part of our patient experience, or what we offer the patient. And I think that'll also be an added dimension, really it's a futuristic dimension, but one that will enhance the experience and give them an appreciation of what we do. So we will regain that pedestal that we once had back in the 70s and 60s and 80s. So I look forward to that. But I did want to just mention to our audience again, Dr. Pearl's book is out, really exciting. ChatGPT MD, please look for it. And I'll give you the final words, Dr. Pearl.
This is the beginning of what will be a revolution in healthcare. I use the example in the book of a pond that has lily pads on it, little green plants, and you watch and 2 plants become 4 or 4 become 8, and you say, doesn't make much difference. But that exponential growth of 2 to 4 and 4 to 8 means that when the pond is half filled one day, half covered in green, the next day it's going to be fully covered. The time to recognize this trajectory is at the start. I spoke on another podcast today. This was like Amazon when all they did was have books. And today, 70% of Americans are Prime members. I don't know about you, but I don't go to the store very often. I almost always order on Amazon because it's so much more convenient. That's a level of expertise that I needed a clerk in the store before to do that I can now do by myself. And that's how we have to see this. And I believe that for the clinicians watching, I know a lot of your viewers and listeners are clinicians, we have to seize the day. That's why I say how empowered patients and doctors can take back control of medicine. We've lost that control. It's been taken over by insurers and drug companies and hospital executives. But the people who need to take it back are the people closest to the patient. And this is the opportunity. Generative AI is that tool. It's not like a narrow AI tool that costs hundreds of thousands of dollars to buy. It's free today, ChatGPT 3.5 along with the update. $20 a month, a latte a week is the cost if you want to get the updated version, which I recommend because it's so much better than the original one. But this is the time for us to do it. And if we hesitate, we wait 3 or 5 years to begin, we will be lost. And so this is the opportunity, and encourage all your listeners and viewers to step forward, read the book. All the Prophets of Doctors Without Borders, if you disagree with parts of it, let me know. I always want to learn from you. And if you like it, then tell others about it. And together, I believe that we can, once again, make American medicine the best in the world. Thank you for having me today.
Thank you. Thank you, everyone. It's great to have you here. Please like and subscribe. We'll see you on the next one.